Today we are having Mr. Abin Roy from United States. Currently he is working as clinical engineer at Parkland Hospital. Welcome Abin. Can you please start with a brief introduction about yourself?
Yeah, my name is Abin Roy. I did my bachelor's I born and brought up in Kerala, in Cochin. I did my bachelor in Tamilnadu in Salem, Vinayaka Mission University. Then I did my master's in England. Then I worked 1 year over there. Then I moved to a little bit travel all over the world. Then I moved to Middle East, Saudi Arabia. 3 years I worked over there. From there I moved to United States, and it's been 2 years now.
Yeah, so you have worked in different countries, including India, London, Saudi Arabia, and USA. So, as a biomedical engineer, what are the difference you have felt in these different countries? The role of a biomedical engineer.
Yes. So, I don't have actually much experience from India. Only 1.5 years I work in India. Then I moved to United Kingdom. So, what happened means what I noticed, in India, we do all the machines. We do the preventive maintenance and corrective maintenance because, for the cost cutting and all. So for example, I'm saying, as a vital sign monitor, we doing the preventive maintenance and, something yearly checking and everything as a routine, So if you move to Middle East or UK or United States, we don't do like a Class C equipments like a regular based PM or corrective maintenance. Something repair come, we do. Otherwise, it's like we put a green sticker. So no PM, we're not doing any PM on that machines, So something is come up, like for example, any repair come up, we will repair it. Otherwise, let it go its own way. And mostly we change the batteries like a couple of years, what manufacturer recommending every 2 year or 3 year. So we replace the batteries. That's it.
Okay, for my doubt, so there are companies recommending preventive maintenance as well. So what about that?
So I don't think so. Any company is recommending preventive maintenance on Class C equipments, but like defib or something like the big machines like a chemistry analyzer or X-ray machines, that manufacturer recommending, and only manufacturer trained people doing the PM on that machines, that kind of machines. Otherwise, we submit a code or getting the service engineers from the company, on manufacturer company engineers. The field engineers come and perform the PM or whatever, the repair or whatever.
Okay, so currently you are working as a clinical engineer in the United States. So what are the major responsibilities you are having?
Yeah, clinical engineering role is a little bit kind of a mediator, We just discussing with the user end and the manufacturer end. So for example, one of the users saying, hey, I need a new EKG machine. For example, I'm saying. Okay. So user already used some kind of machines, right? So he or she is happy with some kind of manufacturer and some kind of features, they need it. So as in my role, I reach out the companies, whatever the user demanding, I need to match with the manufacturer, hey, these are the requirements user requesting. So I need all of them. Then my role is I need to negotiate the price. I need to get some different codes from the vendors and how much the warranty they're providing and, how much the support, for example, if you buy a equipment and next year they don't providing any support or the parts not available, we screwed up, right? Yeah. So we need to make sure, they're providing like technical supports and they have a good backup, So that's a major role of clinical engineering, supporting user and discussing with the manufacturer and supporting even manufacturer also. Yeah.
Okay. So what about the daily routine of a clinical engineer in a hospital?
Actually, clinical engineering person can work from home also. Sometimes, because we have meetings and all the time is discussions and all. So it's our hospital. We work 8 to 4 or 7 to 3. It's fine. 8 hours job. So it's flexible.
Okay. In India,
For
we do daily rounds, everything like that. We visit different departments and verify whether equipment is working and taking the feedback and all. So the same kind of work is the
Yeah, actually it's a biomed job. Clinical engineering is little bit above than biomed. So the biomed people make rounds on their own department, and they do daily rounds. But clinical engineering guys, we don't do the daily rounds because we don't have the time already. We tight schedule with the meetings and discussions. Purchasing new equipments. That kind of role.
So I just want to clarify. So you have a clinical department, also a biomedical department as separate. Is it?
No, actually, it's a new trend. We're not calling as a biomedical department. It's a new trend. It's the clinical engineering. So under clinical engineering umbrella, we have biomed, we have imaging, we have electromechanical team. You know what I mean? Electromechanical team take care of all the bed repair and all patient bed, patient lift, then stairs or lights, that kind of type electromechanical teams do. So imaging take care the radiology side. Then regular biomed take care all the rest of the things, like EKG, defib, giraffe warmers, the regular biomed stuffs, the regular equipments.
So that comes under clinical engineers.
Yeah, so we called not even we in other country, even when I was in England also the same thing, under clinical engineering, it's under the umbrella we doing these three subdivisions. Okay. So moving forward, like nobody called biomed engineering as a department name. Biomed is a section. Okay. Even KIMS in it, Trivandrum KIMS have a clinical engineering team. I noticed.
Yeah, I have studied that. And one more thing, when we are doing the service part, in India we have CMC and IMC, all those kind of service contract. Is there any such kind of service contract you are taking from the company side?
Yes, we do the CM. Actually, corrective maintenance means some repairs, so small kind of repairs. So different kind of repairs, for example, something we can fix it, like a biomed person can fix it, and we have the parts, they will fix it in shop. Otherwise, we send it out for depot repair. We send it out to manufacturer, and manufacturer repair that one and send it back to us. So that kind of thing is a corrective maintenance. So preventive maintenance, the same thing. Some EKG we can do PM, but we can't do a PM as a regular biomed. We can do a PM for X-ray machine. So manufacturer not trained like the one you work in a Beckman machine, we can do the PM. So Beckman engineer is a manufacturer trained engineer should come and do the PM. So what happened means so the PMs, the two kind of PMs, right? As a biomed can do, and one more thing is the vendor need to manufacture trained people come and do the PMs. So two kind of PMs and corrective maintenance. So we have different options, like third party people. Some machines, we can't repair. We don't have the parts, we send it out for depot repair, either to manufacturer or either to a third party company. Okay, what about the number of backup units you are having? What do you mean by backup units? For example, if we are going to operation theater or ICU, we have ventilators. So those kind of critical equipment. So when any breakdown is coming up, it is important having some, backups as well. Actually, in US, the main thing is, we need to take care of our hospital and cost-wise, because we have a budget, we don't want to over purchase, for example, we have only 2 person and 10 ventilators, we don't need it. So we make sure, as a clinic engineer, we make sure the budget also good. So for example, as a 10 patient, we have 10 ventilators. So we will maximum, we put 2 only or 3 only. So we don't put much backup because something emergency come, we can rent it. We have the option for renting. Okay. It's not for a long time. Something emergency is as this pandemic situation, we bought some CRRT, the dialysis machines. We need a lot of dialysis machine and we need a lot of ventilators. So what we did, we only rented it because purchasing new ventilators, it's gonna be a big tough because
Yeah.
after this pandemic gone, it's gonna be too much for our hospital budget. So it's a few ways. Renting is easy thing. So we can rent equipments for managing the budget.
Yeah, of course. And in India, we have called coding. Maybe if there is a breakdown code, there are different things people do. Maybe registering the complaint in a log book or using the software to log the complaints. So in that way, how in USA people are managing these codes and maintaining the database and everything.
I think nowadays nobody using the logbook, everything in the system, right? We have the software, Nubalo service now. I think that's a pretty standard everyone using. So yeah, everything is in the system. Even somebody put a ticket, it comes to us in the system service now. Then we creating whatever we changing the working progress and we doing after the work we closing that ticket, so they will also get a notification. Hey, this guy finished your work. Even some people working in the night, right? The nurses working in the night put a ticket, and they left in the morning. So as a Biomed went to there in the morning and grab the equipment and fix it and return it. We not seeing the user, right?
Yeah.
So it's in the service now. Once we submit the ticket and once it's closed, so they get a notification also. So we are all in the same page, So everything in the system. We have how many hours we work, time, how many PMs a person have, everything in a chart in the service now in Nuvolo. Nuvolo is I think the basic platform we're using all for the clinical engineering or biomed work codes and for this kind of things.
Okay. Great. And you have worked in different countries. So what about the salary package these countries are providing, or what is the average salary we can expect in United States?
It depends. All the countries have different packages. I work in India. I started my career as I think 10,000 rupees or something like that. I'm sure it's not something like that. 10,000 rupees. I'm not feeling any shame to say like that, but it's a starting time. After that, I moved to UK. I get if I say in rupees, I get more than 3 lakhs. So what happened means, the thing is, it's a different qualification. For example, hey, I got my bachelor's degree, give me a job. Nobody give the job, because in moving forward, the requirements is needed, certifications. Hey, did you get any train from manufacturer? These are the priorities people are looking for. So it's all depend on all negotiations. For a package is saying 100. For example, I'm saying your salary is 1 lakh rupees. Okay, we can go for more than that 1 lakh, and somebody can give you less than 1 lakh also because of negotiation, and it's depend on your experience. As an interviewer interviewing, and you saying, hey, I have this kind of experience and my previous I'm expecting more than 1 lakh, then only I need this job, something like that. People do negotiations, right?
Yeah. So what is the average salary we can expect in United States?
Average salary as a biomed, you can get biomed. Clinical engineer is more than 100,000 annually. Okay. So biomed, you can expect $4,000 monthly.
Okay, nice. And I'm sure there will be people who are interested to work in USA, to get a job in USA. So is there any possibility we can get a job there?
That's a tough question. Very hard to get people bringing from India to US as a visa holder. Migrating. We don't. US not doing migration, and some people come for study. Then after
so I think that will be the best possible way we can get it.
Yeah, that a little bit tough now. Right now because changing the visa and all, but our president is helping for this kind of students also. So hopefully they will get the visa, and if we have visa, the job is for sure.
Okay.
don't have visa, that's a tough situation because nobody providing the visa nowadays. So if you have visa, you have the job because in a lot of vacancies in biomed field. That's
Yeah.
otherwise, you need to marry somebody from America, so they
That's
can move
also
to
nice.
here and get the job.
Yeah, and you have done your masters in UK, right? So can you please
Yeah,
explain about your course and your experience there?
that was totally good experience, and it's a really I have nothing because in engineering we do all the semesters, assignments, writing assignments, and it's totally different, But when I did my masters in England, what happened means everything in assessment by in laptop, typing assignments, seminars. It's a tight schedule because in London we're doing the masters in 1 year, so it's a little bit pretty tight schedule. And what happened means it's more interactions, And the classes, not important with the classes attending, but when more is reading, assignments, they're giving a topic and we need to read a lot to understand, and we bring it down and writing the assignments, no, we can't do copying, because it's a plagiarism software is there. They would catch you if you copy.
Yeah, I
So
understand. So what about the scholarship possibility or the total expense you had in UK?
I paid around at that time, 2009. I paid around 6.5 lakh for the college fees. You get scholarship too if you have more than some percentage of mark in engineering bachelor's. You get scholarship because I got some kind of scholarship, but I'm not getting a huge amount, but a little bit scholarship. Our team got it, and I also got it. So
Okay.
yeah, scholarships are provided from some major universities,
Okay. Of course, after completing the course, it would be the focus to get into any internship or a job. What about the support provided by the college or the university?
Yeah, they like to provide a lot of opportunities they will give to you if you like it, because sometimes the scholarship and sometimes they give us if they like you means as a colleague or student or employee, they can put you in a internship or research assistant. Some projects going on, they put you as a research assistant. Only the thing is the payment is not really good, but you have a lot of experience with this big people, the manufacturing companies and all. So of course you will get something.
Okay. So
I also get it, but what happened? My visa time at that time, the UK Prime Minister changed the students' visa rule, so I have to come back to India, because my visa expired. But one of my friends got visa later. I mean, not my year time. Next year, somebody joined. Next batch people got the visa.
Okay. So you have worked in different countries as we discussed. So what about the job opportunity in all those countries? Where you find it more easy to get a job, or in the salary aspect, or the way get in touch with recruiters? So how's your experience on that?
Um, Actually, in that case, I believe London is a little bit tough to get the job, for Biomed, You will get the job, but a little bit the interview panel and, a little bit the process is a little bit tough in England, but easy to get in Middle East and easy to get in US also. US, a lot of opportunities. The interview is really tough, 3, 4, 5 round interviews. But the thing is, lot of opportunities, lot of vacancies, so you can jump in somewhere as soon as possible now.
Yeah, so you have worked in different hospitals. So how you find this job? How you applied for this jobs?
When I moved to United States, I started in a small hospital, like a 300-bed hospital first. But my entire previous experience was in a biomedical engineer or manager level. So when I moved to United States, they put me down because I don't have any US experience. So I joined as a biomed, same like Biomedical, Then I started after 7-8 months. I found a different job opportunity in here county hospital, like a government hospital. So I just applied in and they interview me, and I got it.
Okay, okay. So which platform you find it useful to get a job? Either maybe you may have LinkedIn or your personal network or how it was.
It should be more easy if you have personal network, and I tried in LinkedIn. LinkedIn is the best platform to applying jobs, and up to date jobs are coming in the LinkedIn nowadays. I mean, because the recruiter websites nowadays not really, it's a beneficial maybe, but not seeing much. So any good companies, good manufacturers, they put job openings in LinkedIn. So easily you can catch up in LinkedIn.
Of course, this video will be watched by many biomedical engineering students as well as the job seekers. So what is your advice to them?
You all are in a safe field and in a very interesting field. Of course, no one will regret it. Hey, I'm in a tough field, or it's really not good for getting money or earnings. No, it's a really good field, and day by day, interesting new machines are coming. You can learn a lot of new machines, and improving your, like, in developing your knowledge and ideas and all. So it's a really good platform, and because of the COVID pandemic and all, we everyone need biomed nurses, doctors. So you will not run out without job. You will get a job easily. Not easily means not like this, but if you play smart, you will get a job easily.
Yeah, of course, that was a valuable comment. So I think you have shared a lot of your experience, and thank you for joining us today.
Yeah, thank you, Sathar, for adding me on your YouTube videos and all. Thank you, appreciate it.
Yeah, thank you so much.